Okay, let's unpack a truly vital and frankly a bit vexing issue today.
Uh-huh.
We're doing a deep dive into a recent original article came out in 2025. It's titled Analysis of Characteristics of Patients Whose sugammadex Claims Were Denied by the Auto Insurance Claims Review Department of Korean Health Insurance Review and Assessment Service, a retrospective single-center review.
Quite a mouthful.
It is. But our mission here is to really dig into what this study, it's a retrospective one from a single center in Korea, what it found about why sugammadex claims for traffic accident patients are getting denied by auto insurance. It's something, many of us have probably run into.
Absolutely. And what's fascinating here, and I think critically important for our practice, is how they did it, the methodology.
All right.
This paper, it meticulously analyzed electronic medical records and hospital insurance data, too, covering January 2019 right through to December 2023.
So a good few years of data.
Yeah, it's a long time frame. It was, like you said, retrospective, single center, and observational study. Importantly, it had IRB approval. And their goal, it was to identify patterns, characteristics, of these claim denials.
Which gives us that granular look, right?
Exactly. A crucial look at this persistent discord between, well, best clinical practice and administrative policy.
Absolutely. And the sheer number of denials they found is quite eye-opening.
It really is.
They looked at 251 patients whose sugammadex payments were denied. Now, the deduction rate did drop significantly, which is good news, I guess.
Definitely an improvement.
It went from, get this, 88 to 100% in the earlier years.
Wow. Almost everything.
Yeah, down to 43.4% in 2023. But still, that's nearly half. It's clear deductions are still a significant ongoing challenge.
It's still a major hurdle.
And here's where it gets really interesting, particularly thinking about patient safety. A large chunk of these patients were high risk.
That's the concerning part.
Around 40% were ASA class 3 or higher, so
Yeah.
severe systemic disease, and almost 32% were elderly.
Over 70.
Over 70, yeah. And the main reason cited for using sugammadex in these denied cases, over half, 55.1%, were for deep neuromuscular blockade.
Which makes sense clinically.
Right. And 23.1% were specifically because they were high-risk patients. These are precisely the situations where we, as clinicians, feel we need sugammadex's rapid, reliable reversal the most, for safety.
This really raises a profound question, doesn't it? Why? Why were these claims denied? Especially for these high-risk cases where sugammadex is so clearly and often clinically indicated.
Exactly. What did the study find there?
Well, the study found that even with, pretty robust documentation, neuromuscular transmission monitoring, for instance, was documented in over 81% of the cases.
So the monitoring was there.
It was there, and the quality, the fidelity of the anesthesia records got significantly better after 2021, but the deductions persisted.
Despite better records.
Despite better records. For example, 67.1% over two-thirds of these denied cases still had documented deep or moderate neuromuscular blockade.
Which is a clear indication.
It's exactly the situations where the 2023 ASA and eISSN guidelines strongly recommend sugammadex. For patient safety, for optimal recovery, it just points to a clear fundamental misalignment, between what we know is medically necessary and the current insurance policies.
Yeah.
It's not just some minor bureaucratic thing. It feels like a persistent challenge to delivering the best care.
That's right. It sounds like, a constant uphill battle for clinicians, doesn't it?
It can feel that way.
To know what's best for your patient, you document it thoroughly, and then it gets second-guessed by an administrative decision somewhere else. Did the study give any insight into the insurance side, their rationale, or was it purely focused on the clinical data? Because for these high-risk patients, using sugammadex might actually prevent complications that cost way more down the line.
That's a great point. While the paper focused mainly on the clinical data, the patterns of denial, it implicitly highlights that exact disconnect you're talking about. It suggests, a lack of alignment in the criteria, where the insurer's review process maybe doesn't fully incorporate or prioritize the updated clinical guidelines or the sort of nuanced needs of these high-risk folks.
So the policies haven't caught up with the guidelines.
That seems to be the implication. The authors conclude that collaboration is crucial between us, the healthcare providers, and the policymakers, the insurers. This isn't just about getting paid, right? It's about making sure the choice of reversal agent is guided by the best clinical evidence.
Not just economics.
Not just economics or maybe outdated criteria.
So what's the bottom line here for us listening? This deep dive really underscores that despite our best practices, thorough documentation, clear clinical indications that line up with modern guidelines. These sugammadex claims for traffic accident patients are still getting denied.
Yep, still happening.
It's a stark reminder that, well, policy revisions seem urgently needed to really align with current clinical evidence and make sure we can provide the safest, most effective care without these administrative roadblocks.
Precisely. And the study, by detailing the clinical circumstances so meticulously, it provides really compelling evidence for that need. Maybe a truly thought-provoking finding for you, the listener, to consider is this. How can we, as a community, effectively advocate to bridge this persistent gap, this gap between guideline-driven care and the reality of reimbursement? How do we do that to ultimately safeguard patient outcomes, especially for our most vulnerable patients in those critical moments?